So I actually wanted to chat back to Michelle, seeing she's spoken last first question. But tell us a little bit about your journey to Femgevity. What prompted it? What and where do you see, the world of digital healthcare innovation really impacting women in menopause?
Yeah. So my journey with Femgevity, I founded it with my partner and co-founder, Kristen Mallon, and we are longtime friends and business colleagues. And between Kristen's clinical background and my diagnostic lab, we saw such a dearth in what women need and what they're not getting from a clinical perspective and innovative. And we came together and mined a solution with being able to tie in longevity medicine with menopause care, because it's not as simple as just treating with some hormones, but it's also from seeing it from a very optimal view, from a bird's eye view, and everything that's going on in the body, and that things tie in together. So, my journey is diagnostics background. I worked in women's health and molecular and cytology and genetics and things like that. So I've always had this deep passion for more innovation. Our healthcare system has lacked so much, and everything's really just based on what the guidelines are and with no clinical scientific evidence. And we saw an opportunity because what is out there isn't doing it the way we are, with a longevity focus to, menopause is the now, but what is the future too, right? So this menopause is 7 to 14 years, but you hit 60 and people are living a lot later, and they're living later because they're able to prevent disease during this time of their life if they're seeing the right trained professional. I also have a personal story that my mom was misdiagnosed years for being told that her symptoms were going through her changes and they were menopause. And it actually wasn't. She had cancer, cervical cancer that, had spread, and because she had spotting, and that came from her OBGYN because the lack of the training. And that really hits home for me, because we see patients daily that have like spotting and other type of symptoms, and they just think, oh, I'm just going through my changes. And no, it's not just about getting your estrogen and hormone. You need to get, an endometrial biopsy. You need to get vaginal ultrasounds. And those are things that we could give guidance on women so much further in their personalized treatment plans, and we'll follow them through their journey past even menopause.
Amazing.
And Kristen, now, she is a midwife, so she's been touching women and hearing and knowing what they need and want. So we really have a very impactful hands-on journey to get us to where we are.
Amazing. Well, we wish you amazing success, and we can't wait to hear. Martin, my next question to you would be, how does your research and presentation of your research influence organizations to start thinking about implementing menopause-friendly workspaces?
Yeah, it's a good question. It's a tough question too. I'm hoping that the research will be used as a catalyst for organizations to actually start doing something about this topic. Typically, a lot of my work is around education and awareness, so raising both education and awareness to try and diffuse the stigma that surrounds mental health and well-being. And when we talk about, especially when a guy talks about menopause, the reaction is, I often get is, most people say, I had no idea. So a lot of what we need to do is just get people talking about it, getting it much more, the conversation becoming, normalizing the conversation. And as Michelle has touched upon, it's not just something, a symptom or a topic that impacts the females. It's a human issue. It impacts us all, irrespective of our gender. And the more that I can do to raise empathy and understanding on a topic, and hoping that data is the starting point for that, that would be amazing. We use data in so much of our daily lives, from our quantitative self to measuring footfall in shops, how much money we spend on our shopping, the supermarkets. Why don't we use data to really understand mental health and well-being, and menopause is a key tenet of that.
Well, thank you for that. And I urge all our audiences to reach out to Martin. Maybe we can find a way of expanding this kind of research model that he's done to other countries and to other menopause societies. And let's get a more sort of global picture and see how we can really, really take this fantastic work that you've done further. So thank you for that. Claudia, I have one question for you.
Sure.
Can you give us an example of a successful implementation of a menopause workspace project? Maybe some of the barriers you faced, how you overcame them, what were the results?
Yeah, okay. Can do. I had a company, for example, one of a sort of medium-sized company in the UK, 60 employees, about, I want to say 17 were above 40 maybe, and a larger number was female. They invited me for an awareness talk initially, and that was very well received. Men and women took part, and that was very good. And then we just started talking, and I said I could offer, we could make a little survey at work. I could offer some one-to-ones to really find out what the needs are for women. And that was very interesting. They were very open. They came back and said, look, why don't we look at how we have our workspaces, what we could improve on them. And of course, they were already aware of small changes that can be implemented quickly, but they just wanted to see whether they're actually finding these solutions for their employees. And so we did this. We made little assessments. We then held 3 workshops on different symptoms and what can be done in the workplace. The women and actually some men went back and changed their workstation accordingly, which was very interesting. And then they were very keen on writing some guidelines, but only short, brief. It's not a big company. They just wanted to reassure their women that as it come to it, they can really turn to them and confide in them and say how they feel about it and who they can contact. They can ask for workstation reviews according to their symptoms at a time. They could ask for a supporting body in myself to go with them to the HR department. And I mean, overall, this was the best example, really, because they were so open to this change, and they had a very positive feedback. And in fact, they are sort of asking me for an annual review now to come back and just to reevaluate the situation at work. And I think it's just keep the communication channels open, show empathy to the staff and encouragement. And I think that really enhances a good work-life balance in terms of menopause.
Fantastic. Well, we're running really short on time,
Mm-hmm.
but I just wanted a quick summary from the panel in terms of what is the future of menopause in the workspace? What is your vision of the future of menopause in the workspace? I think, Claudia, you go, then Martin, then Michelle.
Well, I'm hoping for more data, really. I'm hoping that governments will back this. I mean, they are starting to do this in the UK. I'm now living in Switzerland, so I'm hoping that with Martin, we get more of this information out to governments and to companies to really support their staff and make, reduce the stigma, the taboo, and make it unremarkable conversation.
Right, Martin.
Yeah, I think as Claudia said, doing nothing is no longer an option. The great thing is we're now starting the conversation. More and more people are talking about this. The UK is certainly leading the way, but Australasia and the US are doing some great work. But it's mainly just my aspiration is that we talk about it, we raise awareness, and over time it will just be part of a normal part of our mental health and well-being.
Great. And Michelle? So Michelle, you're on mute. Sorry.
Sorry. To be honest, I think it's going to take time. We're there with a lot of the talk. I think it's going to take a lot of from the political side. I think there's going to be a lot of lobbyists that need to be involved. I think healthcare insurance companies are going to need to be involved since they work directly with the point solutions. So I think there's a lot of noise now, but you know, really what it comes down to, it's a matter of the financial incentive for companies to do this and to really understand it. And I think it's more of education, because to quite honestly, you know, we spoke to the head of operation benefits at Novartis, and it's not there yet. They hear you, but it's not there yet. So it's going to take time. It's going to get there eventually. We're not there yet. So, but things like this is what's going to bring us there.
Yeah. So thank you, our amazing panel, for all your insights. We really, really enjoyed having you. And I'm going to hand back to Michal for closing thank yous.
Yes, so thank you again on my behalf too for, you know, for all your talks and this wonderful panel, sharing all your knowledge and insights to help us create a community of practice to accelerate menopause friendly workspaces. We would like to also thank our board of directors for their dedication, innovative ideas, and constant support. We couldn't do anything without you. And yeah, just thank you again for tonight. If you want to take part and tackle the challenges of menopause-friendly workspaces or education, awareness, or any other kind of gender lens point of view into women's health, please just go to our website, register, sign up to our community of practice, and we will be updating you on our activities and thoughts. Thank you all.
Thank you.
Thank you.
Thank you.